Hello guys, we are testing a new type of settings here so we can bring better content for you in the future. Today we'll be talking about Stargardt disease. First, about the disease. Stargardt disease is an inherited macular dystrophy. Patients usually present with symptoms early in childhood or adulthood. Stargardt disease is often associated with ABCA4 gene, which is a gene associated with the production of a retinal transporting protein. Most of the patients have autosomal dominant condition. However, it can also be autosomal recessive. It's important to keep in mind that Stargardt disease it is a spectrum of disease. Second topic, the differential diagnosis. This is a list of possible differential diagnoses. Fundus albopictus is a very similar condition. However, the disease is associated with other genes, most commonly RDH5 or RLBP1 gene. Patients with cone or cone rod dystrophy may have similar retinal findings. However, the ERG is a key element for the differential because the ERG in patients with cone and cone rod dystrophy will have much more prominent or severe reduction in the amplitude of the waves. Patients with chloroquine or hydroxychloroquine toxicity may have similar blunting of the macular normal reflex. However, they usually do not have the flex outside the arcades. And this is similar to drusen related to AMD or genetic condition. The drusen look different and they don't have many changes outside the retinal vascular arcade. Batten disease is a genetic macular dystrophy where patients have severe behavior and development neurologic condition. The main diagnostic tests to be used for patients with Stargardt disease are FAF, fluorescein angiography, ERG, and OCT. FAF usually discloses a black or hypoautofluorescence in the macula of both eyes, and patients usually have surrounding hypo and hyper autofluorescence spots surrounding the black macula. Fluorescein angiography usually discloses the dark choroid because of the accumulation of lipofuscin that block the hyperfluorescence of the choroid. ERG results may vary. Some patients have subnormal findings, where other patients have almost normal ERG findings. OCT in patients with Stargardt disease may have non-specific appearance with a thinning of the retinal layers, loss of parallelism, but most often the most prominent changes are in the outer retina. The management of patients with Stargardt disease is usually observation. Visual rehabilitation with filters and special lens may improve quality of life and add a few letters of vision. Patients should avoid A vitamin, and it's important to recommend healthy life habits and stop smoking. On the right side of the screen, you may see a typical case of Stargardt disease with the blunting and pigmentary changes of the macula, the flex, the black FAF findings, and the hyperfluorescence of the FA around the macula. I hope you enjoyed this summary of the key features of Stargardt disease. See you tomorrow.